Sorry, we're just completing our setup here. Okay, so welcome to our new meeting today. This is the Division of Social and Behavioral Sciences. My name is Jennifer Githaiga, and Dr. Sidi Sotola is going to introduce our speaker today. So over to you, Sidi.
Good afternoon and a warm welcome to everyone. So I'll be introducing soon-to-be Dr. Namhla Sicwebu, who is a PhD in the Division of Social and Behavioral Sciences here at UCT, and a doctoral research titled An Ethnography of Adolescent Food Practice and Choice in Urban Households of Cape Town, explored adolescent food practices and decision making in low-income, obsogenic environment, with the aim of informing policies and interventions that are responsive to adolescents' needs and values. So her research examined how social contexts such as family dynamics, peer influence, economic constraints, and other broader environment shape food choices. Namhla is also a part-time senior researcher at the South African Medical Research Council, where she contributes to studies on tuberculosis and food insecurity. Welcome, Namhla.
Hi everyone, as clearly indicated, my name is Namhla Sicwebu, and I recently got my results from the examiner indicating that I've passed my PhD, and right now I am concluding with my corrections. So my research explored what adolescents eat and why. And the why was the important aspect of it. So normally when I tell people what the topic of my research is, the common response is, but Namhla, it's simple, it's money, right? Money determines what people eat. And I agree to a large extent, right? Money plays a significant role in people's consumption patterns. But then I've always wondered if there was more to the story than that. And so based on that curiosity, I still decided to go ahead and to just look at food and what was happening within people's food environment. And so I think I want to turn this question over to you guys who are here with me in the room. Is it just about money, or is there more to why people eat what they eat? There are no right or wrong answers. Maybe one or two people can give a guess.
Hello, Dr. Berry. So I think there's more. There's more to what people eat. As you grow up within a family. So that's your culture that introduces you to food you like, the taste, and so forth. As you grow on, then you start to be yourself and see what really you like and what you dislike. So obviously finances still part of that. If you have, then you're most likely going to go with the choices that you prefer. But if you don't, you're most likely going to be consuming what is within your means and so on. So it's very multifactorial biology, which is taste and all aspects and finances, and the environment is school, varsity, or group of friends and whatever you hang around with is going to play a critical part into what you end up eating.
That's true. I think you should have like written my put all of that into just like a different way. Yeah, and it's true, right? And so I think going in, I assumed that it was multifaceted. And my question was, what do we do with that, right? If there's so many factors that shape what we eat, what do we do with that? How do we create policies that will address some of the factors that it's as barriers to healthy eating? What policies do we need to put into place that will, enable young people to make healthy decisions early in life? given just how complex and interconnected the food system is. So yeah, no, that's very true. Does anyone want to say something? No. Okay. So in recent years, we've seen a very concerning increase in NCD-related deaths. In 2010, 39% of all deaths were attributed to NCDs, and this increased to 51% in 2018, and it continues to increase. And so at the time when I was accepting my PhD, at first I was looking at treatment, trying to think about, okay, how can we assist those who already have things like diabetes and high blood pressure to, find ways to manage their disease. But then after more thought, I realized that, it's really hard to manage these diseases, especially diabetes and high blood pressure. So how about if we focus on prevention, particularly since we know what some of the risk factors are? I remember at the time I was doing a study at the MRC, and I met a 31-year-old mother of 3 who was living with type 2 diabetes. First of all, I was shocked to realize that there are people who are that young who are living with this disease. Type 2, type 1 makes sense, right? It's genetic, so you understand why. But then to encounter someone who is that young and living with type 2 diabetes was, shocking. And then she was one of the people who were struggling to manage their symptoms, so she had so many health issues which prevented her from working. And so she was very much reliant on the child support grant in order to support herself and her children, which then meant that she couldn't eat healthy, and it was just like a vicious cycle. So I thought, we need to focus on prevention, since we know what the cause is, which is poor dietary intake. Right now, and for the past few years, South Africa and many other countries in sub-Saharan Africa are going through what we call a nutritional transition. We are seeing a shift from diets which mainly comprised of like vegetables and some starch, etc., to now seeing an increase in ultra-processed foods, and this in itself is concerning if we think about the stats that I spoke about, that I pointed you guys to earlier. And so I thought that we needed to find ways to shift, what is happening, to address this nutritional transition, which is affecting us quite negatively. And then when I was thinking about it and reading, I realized that it was important to focus on adolescents as opposed to other people. And part of the reason is that part of the foods that we eat as adolescents partly shape our health outcomes later in life. So what you eat as a young person is a significant risk factor, for things like diabetes or hypertension later in life. But then also, as the gentleman that was pointing out, young people grow up in certain environments, right? And their food consumption is shaped by the environment itself. But then at the adolescent stage, they also gain more agency. And so they start defining what it is that they like, what they want to consume. And so it's important to then target them if we want to introduce interventions that will encourage people to adopt more healthier, or to make more healthier food choices. But then also we know that at this stage, they become more exposed to unhealthy diets. So they spend a significant amount of time away from home. And so there's less control over what they eat. So I thought it was important to target them because of those issues. But then, as I said earlier, I met someone who was in their early 30s, was living with type 2 diabetes, who couldn't work because of all the side effects or the symptoms that she had. So I thought it was important, for their future and the future of their children to target them and to make sure that they don't develop these NCDs later in life, because then it just perpetuates a vicious cycle of poverty that I think we need to cut. Okay, so now I guess the next question will be, what is the South African government doing about this crisis? And there's a lot, to be honest, that is being done by the government that I think we need to acknowledge. So, for example, we have things like the school feeding scheme, which is aimed at providing nutrition to children who are struggling with things like food insecurity. We have the sugar beverages levy, or SPL as it's called, which seeks to regulate the consumption of sugary beverages or drinks. And then we have the food labeling and advertising regulation that is being drafted and that will hopefully be passed soon, which once again seeks to help consumers make more informed decisions around food and also to address things like advertising unhealthy food to children, etc., etc. And these are great, right, in a lot of ways. But then I still felt that they were not adequate, right? So for one, the onus was on individuals to control, what they do. But at the same time, they didn't fully address some of the systemic influences, right? So structurally, yes, they were doing great, but then what about some of the systemic issues? What about family influence, the family environment, which is quite significant? Does it really look at things like economic constraints? So for example, if you look at the SPL, they've increased, right, the price of sugary beverages based on how many grams of sugar are in that beverage. But when you look at how it translates on the ground, you find that in some ways it disadvantages poor people, right? Because they have to spend more money now trying to buy these fizzy drinks, whereas those who are middle class are not as affected. So there are some weird unintended consequences that they are not being considered because we are not like really looking at the systemic influences behind behind food consumption. And then the other thing that I noticed was that the adolescent voice was actually absent, especially when it comes to research. And, because normally when I was looking at studies at the time, when I started my PhD, I noticed that the adolescents' voice was usually, adolescents' views were usually communicated by their caregivers. Oh, this is what they think about food. And in the few studies that did look at adolescents themselves, most of them were merely processional, meaning that, a researcher went in, asked a bunch of questions and left. And I don't think that will give us a nice, nuanced information on what is happening. And so I really wanted to do that with my research, to really understand everything that informs what young people eat and why they eat what they eat. And so I then went into fieldwork, trying to see what they eat and why. I tried to pay attention to their values, to their needs, as well as to the barriers that they encountered as they were trying to make these food decisions. And as Tilly indicated earlier, I did an ethnographic study. And this again was influenced by my desire to fully understand, their context, the young people themselves, and then the decisions that they were making. So I thought that it would be important for me to spend an extended amount of time in the field, to be in their households, to walk around with them in the community, and to just see how these decisions unfold. I think a lot of us would admit that, eating for the most part is a mundane activity, so we don't really pay attention to why we do what we do exactly. So I thought that I would be able to get some insights through observations as well as through conversations, informal and formal conversations. So the aim of my study was to understand the food choices that the young people were making in their environment, which is like a low-income community, and also to identify strategies that will help us to promote healthier decision-making about daily life, particularly in low context, communities, which, as we can assume, are very, very challenging when it comes to healthy eating, given that we are dealing with economic constraints. So I wanted to see what was possible within those contexts. I went into the field for around 7 months. I did interviews, observations, and activities. And all of these activities were aimed at enabling me to explore these daily food practices and the reasons behind them. And then my study was divided into 2 phases. Phase 1 of fieldwork was around semi-structured interviews. So I recruited around 29 adolescent boys and girls who were aged between 14 to 19 years old when the fieldwork took place. And oh, okay. The interviews were done in person.
Sorry, we're just an issue here. We need to resolve.
Or maybe stop sharing.
Not the screen that's showing that? Yeah, it's a screen. It's not this, it's not the Teams. Something on there.
Oh,
You have got a remote?
Let me see. That's how going on this one. Let me try.
Do you have a remote for the TV? That one? Oops.
Oh, there it is.
Okay, now we're going to.
Super. We're going to. Are you? Can you still hear us?
You're muted.
Yes.
Okay, great. Sorry. Technological glitch. We'll continue. Sorry about that.
Okay, so as I was saying earlier, I conducted semi-structured interviews with 29 adolescents. And so this fieldwork happened during, like COVID. So there were a lot of disruptions. So initially I wanted to do in-person interviews and I managed to do a few, but unfortunately due to COVID, I was forced to change direction. And so I ended up doing some of them telephonically and then some of them were done through WhatsApp calls. And then over there, we have a paper that Sidi, myself, Jennifer as the lead, wrote about our experiences of doing fieldwork during COVID. And then phase 2 of fieldwork comprised the more participant observation aspect of it. Because initially I did interviews, but then I really wanted to spend a lot of time with some of the young people, really seeing some of the decisions that I've been made. So I did about 5 of the young people that I had interviewed. And I tried to, stratify for gender. Initially, I had 3 boys and 3 girls, but then I lost one of the boys along the way. And then I tried to make sure that I targeted young people from different households, so those from poorer households, small middle class, etc., just to gain diverse data. And then this took place in late 2021 to early 2022. And then with these young people, I'll visit their homes, work with them around the community, hang out with them and their friends. And then we also did more sort of formalized activities, so things like food mapping, kinship diagrams, and household mapping. And I did all of this in order to really understand how they navigated their food environment, some of the factors that shape that. And then we also had quite a lot of unstructured recorded conversations around the mapping activities or the drawings that they drew, as I wanted to understand exactly what was happening in there. And then my theoretical framework was social practice theory. And I chose this because it focuses on practices, like everyday practices, which is what I wanted to look at. And it tries to unpack what people do and why. And it pays attention to things like material, what are people using in order to cook? What do they have access to? And then competencies, do they know how to cook? Do they have knowledge about healthy eating, etc.? How does that shape what they end up eating? And then some of the cultural and social stuff that you mentioned earlier. So it helps me to really pay attention to those. So I'm gonna fly through this because of time. And then I am now going to introduce you to one of the participants that I met. She was one of the girls that I recruited into the more sort of participant observation of my study, which is the phase 2 of the research study. She, at the time of the research, she was 17 years old, and she was a grade 12 learner. And she was part of a literacy club in the community that aimed to help young people with homeworks and also transitioning into university. And at the time when I met her, her family was going through a lot of financial hardship, and she opened up to me about all of this during our first interview. And she mentioned that even though she aspired to go to university and to improve her life, there were times when she was tempted to just leave education and go and find work in order to assist her mother with household expenses. She spent her early life in the Eastern Cape, where she was raised by her grandmother. And when she was 6 years old, her grandmother was forced to teach her how to cook due to family issues that they faced at the time. Grandmother feared that she might have to fend for herself, so she thought that the cooking skills will enable her to survive. Basically, she had a skill to give. And then later on, she wasn't able to move to Cape Town. for better educational opportunities. She moved in with her parents. She lived in a nuclear family, so mother, father, and then she had two older sisters, but they lived on their own. They were much older than her. Now, life in Cape Town was far from perfect. Her father was diabetic and disabled. He has since passed away from complications related to diabetes. Her mother worked long hours in a very low-income job. So even though she was working long hours, she didn't earn a lot. And then there was a lot of conflict within the family. Her parents fought a lot. And then she and her father had no relationship because he was convinced that she was not his child. And so there was a lot of physical and emotional abuse that happened within the home that she opened up about. And all of this then translated to what was happening within her food environment or the food choices that she was making. So for one, as I've mentioned, the mom didn't earn much, even though she worked long hours. The dad was reliant on a disability grant because he was blind at the time when I met them, and he struggled to walk as a result of that, and he couldn't, of course, work. But then despite earning that money, most of it didn't make it to the home because he was also an alcoholic. So yeah, they struggled financially. And so when it came to food that the family could purchase, it was mainly like carb heavy because they needed something that would last throughout the month and sometimes like more affordable. So they couldn't really afford things like vegetables, etc. Or light foods, as Lunga will call them. And this was quite concerning for her because she understood that it was important for her to eat healthy. And she also knew that this food really didn't have any nutritional benefits for the most part. But then also, as a young person, she was concerned about her appearance, right? So she wanted food that would allow her to maintain a more slimmer appearance. But besides that, because of the financial constraints that they faced, sometimes she didn't have access to regular meals. So sometimes she'll have access to 1 meal per day, other times to 2 meals per day if she was lucky. Yeah. Now I want to introduce you to another adolescent that I met. This is an 18-year-old, it's a boy. He lived in a hostel that I visited during my time while doing fieldwork. He, unlike Lunga, was born and raised in a township. So his parents lived in Khayelitsha, but he lived in Sicwebu, which is where I did my research. He attended a sports academy. And due to that, there was a lot of emphasis on healthy eating. In fact, the school didn't even allow people to come and sell junk food to the adolescents at the school. But despite that, he still found ways to purchase the stuff that he likes. So he will tell me that, when he was done classes and on his way back to the hostel, if he had money in his pocket, he will just visit some of the sponsor shop and buy junk food. He knew it was wrong because they were taught that constantly. But as he told me, he was addicted to junk food. In fact, he told me that he tried to stop eating junk food for around 3 weeks, but then ended up going back to it because it's so nice. Yeah. So besides these young people, I will now just try to go a bit in depth into some of my findings. So as we saw from Lungo and Lumka's story, young people were aware of the importance of healthy eating. They knew what it is. They were taught at school through orientation, life sciences, etc. But this knowledge did not always translate into their behavior, whether it's through their preferences, so like addiction to junk food, as we saw in Lunka's case, or sometimes because it's just no food at home, or people can't afford to buy what we call healthy food. But then sometimes it was also due to limited knowledge of the link between what you eat and NCDs. A lot of young people struggle to make that link. But then also though, it was, speaking about knowledge, it was interesting because at school, a lot of these young people tapped into a more biomedical knowledge framework. But then at home, there were a lot of conversation around inyongo and all of these things, which is this toxin that you develop if you eat a lot of unhealthy food. And so young people were constantly encouraged not to eat unhealthy food because they are going to develop this thing and get sick. And so they were we're pulling from two different knowledge systems. One which is a bit more indigenous, I guess you would call it, and one which is a bit more biomedical from school. And in some ways, these knowledge systems complemented each other because they spoke about the need to eat healthy food. But in some ways, the ways not conflicts here and there, right? So with biomedical model, digestion starts the moment you put food in your mouth. Whereas with the other one, it was like, well, if you expel the toxins from your body, you'll be fine. They don't affect you beyond that, right? And so even though they complemented each other in some ways, they caused some issues in how young people then approached food, right? Because then for some, it was like, I'll eat whatever I eat as long as I patch, whatever food I eat at some point, before it gets me sick or when I get sick. Yeah. And then, as I mentioned with Lunga, she was concerned about what she was eating because she wanted what she called lighter foods. She always spoke about her desire to eat more salad-based foods instead of like carb heavy that she had access to at home. And this was like due to her desire for exploring mostly microgreens. But then there were also quite a few young people who played soccer. As I mentioned, I recruited some young people from a soccer academy. And so their coaches always like stress the importance of healthy eating, because it helps them to perform well in the field, to stay fit, etc. And so for these young people, whenever they spoke about food, they also spoke about the need to eat healthy because of their desire to perform well in the field. Some of them had aspirations to play soccer in the future. So they knew that what they ate affected them in the now, but also like in the future if they want longevity. And so some of their decision making was then, shaped by this desire to, that. And then there were also academic concerns. So a lot of young people spoke about how what they eat affected their ability to.
We started earlier, continue, I'm sorry.
Okay.
Non-disruptive.
Okay. So they felt that what they ate, shaped their ability to concentrate well in class and to do well. So there was also like this desire to eat healthy because of that. But despite this desire or even attempts to eat healthy, this was not always possible, right? So like, yes, their priorities partly shaped their dietary choices, but they were not only things that shaped them to this extent. So we had more sort of like structural barriers that young people were facing. So as it was mentioned earlier, some of them were these like family dynamics, because as I mentioned, they are quite young, right? So even as they gain more agency over food choices, like some of them cooked at home. So even as they gain more agency over food choices, they were not the ones making decisions around what foods were purchased at home. So their decision making was shaped by what was available at home. And then there were also things like conflict within the home. So in Lunka's case, I spoke about how her parents fought all the time. What I did not mention is that when they fought, they would usually spite each other by refusing to buy food at home, saying, you need to buy food. No, you need to buy food. And then at the end of the day, there's just no food at home, which then affected the Dunga in severe ways. But then we also know that eating together as a family encourages healthy eating, right? So there's like less food for snacking or for even cooking unhealthy food. And yet in homes that are full of conflict, no one wanted to sit and eat together because you just want to avoid communal spaces because of all the tension and conflict within that space. And then there were also things like relationship with caregivers. So a lot of these young people actually moved from Eastern Cape to Cape Town at some point in their lives. Some lived with their biological caregivers, others with other relatives. But because they were not raised by those people, even when they recognized that the decisions that were made around food were not healthy, they didn't feel they had the right to question what they were receiving, because they thought that would be seen as defiance. So there were a lot of barriers that they faced just within their households. And then, of course, some older people always assume that they know it all, so they didn't like being challenged by younger people when they were being questioned on why they had to eat meat every day, et cetera, et cetera. So they were facing quite a lot of challenges. And then there were also, of course, economic constraints that we have already touched on, right? which meant that a lot of people just couldn't afford healthy food. I extracted this from my PhD. I don't know if you guys, I'll give you a second to just read that and to see the reality of it. But basically, there was just not a lot of money that could be spent on food. With this family, they spent around 400 on food for all those family members. So you have to like really imagine what people can reasonably buy with that. Yeah. So at home, she could only access 1 meal per day, and it was just like usually pap. And if they were lucky, they'll add some potatoes, which lasted a bit longer. I mean, they call them vegetables. We know they're starch, but to people, they are like vegetables. They couldn't afford vegetables at all. So the only time she got nutrition of any type was when she ate food at school. Yeah. And then there were also things around gender, which, so manifest within the home. And so, as you would expect, a lot of girls were taught how to cook and expected to cook from a young age, similar to Lunga. And for boys, there were really no expectation for the most part, except for like 2 boys who were forced by circumstances to take on that responsibility. One lived with his single mother, worked long hours, and he had to look after himself and his younger brother. And then the other one lost his father during COVID, and his older sister, who used to be in charge of cooking, had to leave home for school. And so because his mom worked long hours and he had 2 younger siblings, he also then had to step up in some ways. So he used to cook every Friday. But for the most part, some of the boys, were just not expected to cook. But a few of them took initiative to learn how to cook out of interest. But again, because there were no expectations for them to cook, they hardly ever cooked. And so we just knew how to cook a few things. But so for the most part, boys were excluded from the kitchen space. And that I felt was detrimental to them because as one of them stated, he thought that in the future, if he was in an environment that supported healthy eating, he wouldn't be able to prepare one for himself because he just doesn't have the skills needed to cook, or what in social practice theory we call competences. Competences. Just get it now. But and so long term, it's quite detrimental to him and to other boys not to know how to cook, right? Especially if they find themselves living on their own. So he just thought that in the future he'll rely on takeout because that's all that he can do. He doesn't know how to cook. And then there's of course the issue of the built environment. So as Lunko mentioned, working that, so even though the environment was controlled and there were no touch of were allowed, the moment he left the school premises, he encountered like various sponsor shops, which then tempted him to, buy junk food. So, and in Masquerade, there are a lot of spots like sponsor shops and chifanyamas and all of these things. So it's hard to resist them, especially for young people. They are quite affordable and accessible, and you don't really find a lot of healthy options, to be honest, especially when it comes to snacking options. And then I also realized that a lot of young people actually socialize around food. And part of this was due to how Masquerade is set up. So it's quite small in terms of like township, it's overcrowded. So really there are no recreational spaces or spaces for people to hang out. So young people hang out with each other's homes. And in order to entertain themselves, part of the entertainment then ends up being around food and eating. And of course, they end up just going to Chisanyamas and buying unhealthy food. So the takeaway here is just that, unhealthy food practices are not just personal choices, they are shaped by structural or systemic factors. But then there were also other things beyond nutrition, right? So there were like meanings and symbols that were attached to food. And the one that I would want to zoom in on is the emotional factors, which is like past experiences of food deprivation. So a lot of these young people experience quite severe food insecurity in their past, especially those who are living in areas And so when they move to the cities where they have slightly more access to food, they tend to overindulge, right? Because they have built up, I guess, I don't know, but for them, food either acted as sort of comfort or they just struggle to listen to the impact of their foods and overeat. And so some of them will mention that, after binge eating, they will feel a sense of guilt and try to deprive themselves. So like no one mentioned, purging, but there was quite a bit of like disordered eating that is like linked to this past experience of food deprivation. But then the other thing that I found quite interesting was like this intersection of like identity and food practices. So as I have mentioned, a lot of boys were really expected to cook, but some of them took that upon themselves to learn and to cook occasionally for their families. And I found it quite interesting how these boys would define themselves. It was like, oh, I'm not like other boys who are rowdy and out and about in the streets, walking around. I prefer to spend more time at home. And, so it felt as if like, they were just defying this like traditional sort of like gender norms that we encounter. Yeah. Which in some ways, I guess, gave me hope that, we can actually change things, that we can change this gender norms around who is welcome in the kitchen space and who's not. And then, so these are some of what I concluded with. So, because remember earlier on, I said that I wanted to identify strategies for that will help us to encourage young people to make decision making around food that is healthy, right? And then also I wanted to contribute towards policies, whether it's like development or even like refining these policies. And so based on my research, I thought that it's really important for us to really consider their priorities as well as their values. So as I had mentioned earlier, young people really think a lot about their bodies and how their bodies look like. So these are some of the things that we should consider. They also think a lot about their performances, whether at school or within sports. So when we are trying to encourage them to eat healthy, maybe we can incorporate some of these things as a way to bridge the gap and to get their buy-in, right? Because I think usually we focus on, oh, you need to eat healthy because it's beneficial, it will prevent NCDs or long term, and for a young person, it's hard to think about what will happen 10 or 20 years from now. So we need to think about how we approach them and how we communicate. And we need to realize that they might not value health the same way that other people might, right? So how do you reach them? And then we also need to incorporate more gender sensitive approaches, right? Because again, as I've mentioned, boys are excluded. So how do we then bring them into the fold? And then, as it was mentioned earlier, the family matters. So instead of like just focusing and trying to change young people's behaviors, how about if we bring more family-centered intervention, because the family still really shapes their consumption practice despite their increased agency. And then at the more structural level, we need like multi-sectoral collaborations in order to address things like food insecurity, for example. So we need partnership between government, NGOs, etc., in order to like really build policies that will help create environments that are supportive of healthy eating. And as we've said, economic constraints are a significant part, so we need to address that first before we can even try to encourage people to eat healthy. So I think I'm going to leave it at that. People can read the conclusion if they want to.
Thank you very much for your presentation. We're going to have a time for questions, comments. There are some of you who are online. If anyone would like to ask a question or make a comment, this is your time to do so. Stop sharing the screen and see if we can, so we can see you. Okay. So any questions, comments from the people who are online? Perhaps as they are thinking, there are people who are sitting in here. Any comments? Yeah, you want to say something?
Yes, thanks. It was very interesting and a very timely presentation. I was quite interested in the role of the school and whether that came out more with some of the other participants, not only the person in the hostel, but the other participants.
Thanks for the question. Yeah, the school was very influential. So we have the school feeding scheme that we have in South Africa, and it's but we have that, right? And for most young people who lived in food insecure household, that became, their source of food. And so, for example, a lot of them didn't have access to grades at home, and yet school then like filled in that role. But then also like during school holidays, I learned that the school would give some of them porridge to take home so that we have that over the holiday. So there was a focus on, nutrition and trying to address hunger within the school itself. But beyond that, it was just what was taught in class. But it was not as comprehensive as what happened at the Soccer Academy, where there were like loads and loads of conversations around healthy eating and ways to like that disability.
Questions, comments?
So I wanted to find out in terms of how the participants themselves perceive the way that they think about it. Did you feel, sorry, the way they think about it, did you feel that they were like, how you sort of say like we sort of look at eating as like a mundane task? Did they have an awareness of like how they choose to eat, the choices they make maybe around eating as being a lot more than just mundane tasks? Did they have that experience for themselves?
Not initially, I think. So when I told them what my research was about, a lot of them laughed me like, wait, what do you mean? Why do I eat what I eat? But then as I asked questions, which were a bit more probing, they started to really think about what informs what they eat. But I think for a lot of them, it was just like, oh, this is what they buy at home. I eat what's available. And then for some of them, there was a bit more awareness around the financial constraints. So saying that this is what we can afford at home. So this is what shapes my consumption. But then through conversations, whatever. But then actually, I do think about health. And this is why I think about health. But I think initially, they were just like, oh, what do you mean? But then as the conversation unfolded, they started to see that actually there was a lot more to their consumption than what they initially thought. Yeah.
I was actually thinking about that, the kind of effect on the participants of reflecting on their eating behaviors, and especially the one person you spoke about in such a difficult family situation. Did that become quite like distressing or like with like a negative impacts on their thought?
Yeah, no, thanks for that question. And I think that's actually what caught me by surprise. Because I think when I wrote my protocol, I was like, me young person, wouldn't need to worry about anything. And I sat down with these young people who were experiencing food insecurity. And I remember this one girl, the one that I spoke about. When we spoke about food, she became so subdued and quite sad. And I could tell that she was trying not to cry at points. And in fact, there was another one where she started crying during the interview because they actually had to sit and like reflect, right, on their situation, their family situation, etc. Because it was not just about food, it was about social relationship, it was about this and that. So yeah, it brought quite a lot of pain and distress for some of them. Yeah.
So you talked about the difficulties for young people to link what they eat now at the age of 20 to NTDs when you're much older. One of your case studies had a father who had diabetes. Did you see any difference in if you had a family member with NTD? Did that impact?
Interestingly enough, no. And I think part of it is that from what I have observed, there's not a lot of communication between caregivers and young people about what the caregivers are going through with their struggles, etc. And so, typically we assume that because the caregiver is struggling, they will gain an understanding of, what I eat actually like shapes my health outcomes in the future. But really, it doesn't happen that much because of the communication barrier. But there was one person who lived with a single mother who was more middle class. She was aware of that because I think they had a better relationship. And the mom shared that, you know what, we need to change our lifestyle because of being diagnosed with A, B, and C. I mean, the young person was quite resistant because she was not willing to, to adopt the change, but she knew what brought it about. But for most of them, communication is hard.
Still the conversation. We don't want you to forget you if you're online, but that's an interesting conversation about the lack of linkage and perhaps a point for recommendation in terms of intergenerational communication within families or across groups, because if they feel that something doesn't affect, that's a disease for older people. I mean, literally, and there's no connection with with that. I had a question for you with methods. What was it like for you to do ethnography? We sometimes downplay ethnography. So it's so easy. I mean, just go and watch people and write your thesis. What does it mean? Because a number of people who maybe would even be online might be interested in qualitative research methods. What does an ethnography entail from your experience?
Yeah.
It looks like it was really easy, eh?
No, I wish it was. No, it would have been great. Yeah, no, it's far from easy, but I think it's one of the most interesting ways to collect data, especially if you're interested in people and their stories and just what shapes whatever it is that you're interested in. But yeah, it's far from easy. It's quite intensive. You collect quite a lot of data, and so even just like trying to organize the data is a nightmare. And then, but the fieldwork itself can be quite hard. So with me, for example, when I started fieldwork, I had all this intention to spend extended time in the field, right? To spend time in people's households. And in fact, we lived there for about a month, but none of that ended up transpiring because Mass Media, which is where I did my research, is quite overcrowded. So I couldn't find a room to write in any of the spaces. But then also being in people's homes can be quite tricky. So for example, in one household, when I was like spending time with a young family, the fight broke out at home and I was caught in the middle as a mediator. So you encounter a lot of things that are quite unexpected. You really see the raw aspects behind people's lives. So instead of just hearing about them, you see them, which can be quite challenging, I think. But I think, yeah, the biggest challenge for me was just the data. It was just way too much data.
Yeah. All right. Just before we take a question from them.
a question there.
Okay. Michael says, thanks for that interesting presentation. When you say interventions, should also target individual preferences. What do you mean by that? What sort of policy interventions can be custom tailored? That's a question from Michael, who's online.
So I think more than individual preferences, it's more that we need to consider young people's values and needs and incorporate that into policies or interventions. So I think it's much harder to deal with preferences, right? But if we know people's values and their needs, we can try to use that as a way to encourage them to eat more healthy. So to say, so you want to keep a more slimmer body? Food helps you go towards that goal, right? You want to perform well, food is a way for you to reach that target. So it's something concrete that young people can like latch onto instead of like saying NCDs, because that just seems a bit too far into the future. So it's also much like individual preferences, because I think there are a lot of interventions that do target those individual preferences, but we know that for the most part they fail. So it's like, how do we then try to do that by really like zooming into people's feelings and needs?
And just an addendum to that question, is there any role that religion, puberty, and associated hormonal changes and issues like peer pressure, pride and shame towards cultural food, do those factors, might they play a role in adolescent food choices? So for Michael.
That's an interesting question. So I think going in, I was expecting just the last part of my shame around certain cultural foods. I was expecting that because I had seen it in literature, but actually there was none of that. And I don't know whether it's because a lot of these young people grew up in the rural areas, so they have a slightly different mindset compared to kids who grew up in urban environments. But for them, those were just normal everyday foods. And I think also Masipule is like slightly unique compared to most township in that a lot of people still seem to have a lot of like a big relationship with the rural areas. So yeah, I don't encounter any of that. And then in terms of religion, again, it didn't really place an effect on what people were consuming.
Hannah, sorry, I cut you short earlier.
No, that's fine. I was just interested, some years ago, I did research not related to your topic at all. But I just observed that some women would be able, these were older than your participants. And they would sort of, on one hand, be aware of health risks. And they would, particularly one that she would constantly go on a diet. But at the same time, she would talk about how her large body was very attractive and attractive to men and be very sort of proud of that. So there were sort of these two conflicting notions. And I just wondered, is that something you also found in your younger population?
I think it's something I mainly read about. But in terms of my girls, it's weird because I think it was the same thing where they would say, oh, I'm happy with my body, and I don't try to do the small things in order to lose weight. So I think that there's a weird cultural shift that is happening. So one way cultural expectations say you need to have like a nice big body as they describe it, but at the same time they are like connected to the internet and social media. And so there's like these Western values that they are dealing with, which say that you need to have a slim body. So young people were just like caught up in the middle and trying to make sense of it. But so even with this girl, Lunga, the one that I introduced earlier, she was on the slimmer side, right? And she made it very clear that she didn't want to gain weight. But at the same time, she mentioned that, oh, but people seem to appreciate bigger bodies. So it was, I think young people still trying to make sense of that and trying to locate themselves by struggling in some ways. Yeah.
Okay, we are about to wrap up our discussion. I just have one question for you. To what extent do you feel your positionality, I don't know how you saw yourself as an insider or outsider, but how did that impact your, how did that shape you're doing ethnography in a local community, South African community? And you said it was a Black South African community. Did that have any bearing?
Yeah. I think I saw myself as a bit of both, to be honest. Okay. An insider in that I understood what people were talking about.
And
I language, the language as well. But then also an outsider because I was so much older than my participants. And so I think I felt the generational gap, right? But then also I didn't grow up in a township, even though I've spent a significant amount of time in township spaces because of work. So I felt a bit of both, like, yeah.
How did you navigate it?
I think in some ways, I thought it was good for me to feel as an outsider. So I felt comfort in being able to see myself in an insider and being able to understand what people were saying. Especially like conversations around Inyongo, which might confuse an outsider. But then I was so glad that I also felt as an outsider because it made me question things. Because normally when you're an insider, you take things for granted. But there were things that stand me, So I think it really added to the richness of the data that I collected. So I don't even think that I tried to get it. I just went with the flow and say, you know what, I'll adopt both of these things, the inside lens and the outside lens, and see how we can enrich the whole process.
Okay, well, thanks very much. We've run out of time. Applause to our soon-to-be Dr. Sicwebu for a job well done. I see some applause from the audience. Thank you all for joining us. And if you have further questions, you can feel free to contact Namhla. You can do it through the department, or they can give you her contact details should you want to engage further with her. But thank you everybody for joining this meeting and enjoy the rest of the afternoon. Okay then, bye-bye everyone.
Yes.